Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is your chance to ask your questions live to me, as well as my chance to answer any questions that you might have placed on some of the videos this week. Remember, we're also on Facebook and Instagram for additional content, so please check us out over there. Please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator and allows me to be here with you guys. If you guys really have any questions tonight, please feel free to put them into the chat. I think due to the holidays, we haven't had a lot of comments on the video, so I don't have a lot to answer for you guys tonight. But I do want to go ahead and get some of those started for you. So we had a couple questions on my bleeding videos. Bleeding during pregnancy, for probably some obvious reasons, is extremely, extremely scary and stressful because we don't expect bleeding during pregnancy. Bleeding is basically considered, bad by most people for obvious reasons because it's most commonly associated with miscarriage. However, there's a lot of reasons why a woman could bleed during her pregnancy and everything could be completely fine. Now, in the first trimester, when we see bleeding, this is when we're actually the least worried. Of course, unfortunately, miscarriage most commonly happens during the first trimester, which is why it ends up being the scariest trimester to see bleeding. But really, there's so many reasons why you could bleed that are totally fine and your pregnancy will be safe, or there are things that we can take care of. And so that's why first trimester bleeding in many respects is probably one of the ones that are easiest for us to manage. However, once we get into second trimester bleeding, it gets a lot more worrisome. And then, of course, in the third trimester, the only time we're really planning on seeing bleeding is when you're actively delivering. So once you're in the third trimester, if you were to all of a sudden spontaneously start bleeding, we actually, our first thought is you're in labor, that you're actually dilating, and that's what the bleeding is coming from. So let's go ahead and get started on some of these. Now, the first question was kind of one that I see a lot, which is basically, I'm 9 weeks and 4 days pregnant. I've noticed a sticky little blood clot in the toilet paper. Is it normal or should I be worried? So any bleeding at all, no matter what the trimester, no matter what's going on, you need to get it checked out, guys, okay? Because you can't assume that everything is fine just because it's a little bit or a lot, just because you might have some kind of diagnosis. You want to keep your healthcare provider in the loop. You want to be talking to them regularly about this. And so when you see any kind of things that could indicate bleeding, including clots are like a piece of blood for anybody who's not aware, you want to go ahead and let them know. Now, if anybody was not aware, when you have a miscarriage, what can come out can look like a blood clot. And so that's why knowing, if you see a blood clot, you need to make sure that you are evaluated. Now, what are we going to do? The most likely thing is we're going to do an ultrasound. And you want an ultrasound because an ultrasound is going to tell us a lot about what's going on inside. An ultrasound can tell us if there's a placenta issue. So there could be a couple different types of placental issues. There could be a subchorionic hemorrhage, which I have a video on, but that's basically like a pooling of blood underneath the placenta, kind of like a bruise on the skin. You could also have a placental position issue. So you could actually have a placenta previa, which is where the placenta goes completely over the cervix. You could also have a placental abruption. So placental abruption is where the placenta is actually detaching from the uterine wall. So these are some of many placental issues that could be causing bleeding that we can see on ultrasound. We can also look to determine the position of the baby. So if your baby is positioned in the fallopian tube, that's actually called an ectopic pregnancy. And that is a medical emergency, and you need to have the fallopian tube removed, okay? So that's not a viable pregnancy, and that's something that we can determine. But if that pregnancy is growing in that fallopian tube and the fallopian tube's about to bust, you can actually have a lot of pain and bleeding associated with that. So those are just a couple things. So how do we figure all this out? Ultrasound. That's really what we need to do, is an ultrasound and determine what's going on inside your body. So that's why it's so important for us to check things out. We can also do a lot of blood tests based off of that and stuff like that. Now, the other question I had, which now goes into why it's also so important to call your healthcare provider. I'm 11 weeks pregnant. I started bleeding heavy, so I went to the ER. They said I was good. The baby was good, but I was bleeding heavily. When I was leaving the ER, they said I had a UTI. I am currently on antibiotics. The bleeding has stopped. It was brownish for 2 days, and now I started bleeding again. My OB is booked, and it's the holidays. The offices are closed. This is my 6th pregnancy, and I've never experienced bleeding before. So this is a good kind of situation that can kind of add on to the first part. Okay. So one of the common causes of bleeding is infection. Guys, I think infection is poorly talked about in pregnancy. Okay, so I feel like when it comes to risk versus benefit discussions for pregnant women, they're often very lacking. And that's why I see a lot of women show up on the channel asking if they can take different antibiotics. Now, I definitely advocate for you to ask, re-ask, get second opinions. If you're not sure about putting something into your body, make sure. Ask your pharmacist about the safety of medications. Ask a second opinion of another OB-GYN or a midwife. If you're not sure, I understand wanting to do your due diligence. And that's good. What you're doing when you ask about the safety of medications is risk versus benefit. But what I think is lacking is they don't ever tell pregnant women very clearly the risk versus benefit of not taking the medication. And so one of those is bleeding and miscarriage. Urinary tract infections, UTIs, which is mentioned in the second question, is one of the number one causes of miscarriage. It is so common and so easy to get when you're pregnant. And the thing is, the only way to treat a UTI is with antibiotics. Don't listen to anything that you hear online. There is no homeopathic treatment for a urinary tract infection, guys. Now, in my practice, I actually hold certification in alternative medicine and culinary medicine for mood. I am very big on vitamins and other alternative medicine treatments, like huge. My kids have an alternative medicine pediatrician as well as a mainstream pediatrician. This is something I am very, very pro. But the reason why I become conservative as a provider to pregnant women, where I am a lot more open and alternative to the rest of my patients, is because pregnancy is such a short period of time. It's amazing how fast this goes. I actually have patients that it seems like yesterday I was helping take care of their babies and their babies are going into middle school. It's like that, guys. And if you can think about that period of time seems like yesterday, imagine 9 months of life going by within an instant. And all of these things that we're treating you for, all of these things that we identify and need to get done, we need to get done fast because we run fast. So when it comes to a urinary tract infection, first of all, there is no homeopathic treatment. If somebody had months and months and months to deal with a chronic UTI, they might be able to get some headway using real cranberry juice, lots of fluid, D-mannose, and these are all things you can read online about as treatments. But when you're pregnant, you don't have months and months and months, because I have watched women deliver prematurely due to a urinary tract infection that was not treated. What happens with urinary tract infections is the bladder, it has two ureters that go up to your kidneys. And the kidney is very vascular. That means it's got a lot of blood running through it because it's filtering your blood. And so if you get this bladder infection that doesn't get treated and goes up into the kidneys then transmit that infection into your bloodstream. And a bloodstream infection is called sepsis. Well, in essence, what are you feeding your baby? You're feeding your baby your blood through the placenta. And the placenta, while it is a filter, it is not a perfect filter. And sepsis, a bacterial infection of the blood, will pass through to the baby. And that's life-threatening for the baby. And that's what causes the miscarriage. So what you need to understand is that this can all be prevented by a simple antibiotic. but trying to homeopathically treat it with fluids and cranberry juice just isn't going to fly when you're pregnant, guys. Now, because you get this infection, that makes the whole vaginal area, the uterus, everything, all those tissues are very, very irritated, inflamed, and infected, which is why they bleed. That's what actually ultimately causes the bleeding. Also, if you've developed from a urinary tract infection to a kidney infection, which is also called pyelonephritis, you can actually have blood come out into your urine. And so sometimes women will see bleeding and they think it's coming from the vagina when it's actually coming from the urine. And that's because the infection is spreading. Now, one of the things that was mentioned was the blood was brown and then she started bleeding again. So brown is old blood. I actually have a video on the colors of blood and stuff like that. So you can check that out. But brown is old blood. So if you go from brown to red, that means the bleeding is resuming. That's a big, big warning sign. But if you guys are not sure and you are bleeding, go to a hospital, okay? Go to a hospital, go to a hospital, go to a hospital. Do not worry about being the person who cried wolf. I promise you, it is not worth it. In my practice, I take care of many pregnant women, and I've taken care of many women who've lost their babies. And I will tell you, the women who didn't want to go to the doctor because they were embarrassed because they felt like they were complaining too much and then lost their babies, that's something that haunts them, is that they didn't go in that one last time to get things checked out. Always get it checked out. Who the heck cares? If you go in and they're looking at you like, oh my God, here she comes again. Who cares? Who cares if you get a scan and the baby's good? It's important that if you have a real symptom or a real concern that you get it checked out. So for those of you who are joining me, hi, I'm Dr. Samantha, the maternity mentor. Please put your questions into the chat because I have literally like one more question, maybe two. So I want to make sure you guys answer them because otherwise I am totally getting out of here early because, work and stuff. Now let me look and see. The next question was my wife is pregnant, 9 weeks pregnant, and she was prescribed diclofenac sodium injection, I'm sure is what it means to say. Is this going to harm the baby? So this was an interesting question. And I was, it came in on my antibiotics video, which is fine. People put a lot of questions in a lot of different places. Diclofenac is not an antibiotic. So diclofenac is actually almost like a steroid type of medication. It's usually used for pain. And it was interesting because we don't really use it a lot during pregnancy. So I had to pull it up. And that's what I'm looking at the side. So what I want you guys to know is all of us who are in this business of working with women who are pregnant or breastfeeding, and we're working with medications, we get different types of training. There are a lot of different organizations that help to deliver different pieces of safety information about these medications, right? So there's a lot of different places that we can look for. And one of the places that a lot of us turn to is a book called Medications and Mother's Milk. It's by Thomas Hale. He also runs the infant risk line. He's out of, I think it's University of Texas. And he's developed this rating scale by aggregating a whole bunch of different data together, including animal studies and studies on people who are not pregnant and all different things to kind of look at the safety data for these medications and to create a safety scale. So in pregnancy, there's no real studies on NSAIDs, which diclofenac is an NSAID. That's a non-steroidal anti-inflammatory drug, NSAID. Again, usually used for inflammation and for pain. Now, NSAIDs, there's no reason to believe that they are unsafe in the first or second trimester. We can't say for sure that they're not, but there's nothing to make us believe that they are. But during the third trimester, they are absolutely 1,000% contraindicated. You cannot use them, and it puts the baby at high risk if you were to use an NSAID. So diclofenac in the third trimester is an absolute no. And this is why we don't really use it at all. So Why is diclofenac dangerous to a baby in the 3rd trimester, but not the 1st or 2nd? So there is, when your baby's inside your belly, right, your baby's heart and lungs work just a little bit differently than they're going to work on the outside. So our heart and lungs create our circulatory system. That's how we move our blood around and how we get oxygen and get rid of carbon dioxide. That whole system is closed, okay? However, during pregnancy, because of the umbilical, like the placenta and the umbilical cord being the baby's actual circulatory system, the system is open. And so as a result, there's a little hole that the babies have. It's called a PDA, patent ductus arteriosus. Now, the PDA is normal, okay? This little hole is normal. And this is why people sometimes can still have a hole in their heart and not realize it. It can heal over. It's all different types of things. But the PDA is necessary and has to be there when a baby is born. But if we go ahead and we give an NSAID like diclofenac, it will actually close that early. And if that hole closes early, that will actually lead to a life-threatening situation for the baby, and the baby can pass away very quickly. Now, one of the things that what happens is when you deliver, the release of prostaglandins naturally is what closes that hole. Sometimes the hole doesn't close on its own, and we'll give something like a diclofenac afterwards to help close it. But you do not want to have diclofenac in the 3rd trimester. So this is a really good reason why you want to make sure you understand what medications that you're taking, guys. And I think with the medication safety aspect, one of the things that I like to tell people also is you need to make sure that if you are a woman of childbearing age, with the ability to get pregnant, even if you are on birth control pills, you need to know what's going on with your body. You need to understand what interferes with birth control if you are using birth control, especially birth control pills. I recently had a patient who we had to do not blood tests. She actually had to take a pregnancy test. She wasn't pregnant, but what had happened was she was showing all the signs of pregnancy. And she was like, and when I talked to her, I'm like, you need to take a pregnancy test. I think you might be pregnant. And she said, no, I'm on birth control. I haven't missed one. I haven't whatever. She had taken antibiotics, and she had no idea that antibiotics can interfere with control. So that's one of the things that I think is important for everybody to understand, that anything you're putting into your body has effects of. You want to make sure that you're being very careful. Now, in the case of, let me think here. I'm trying to think of a good medication. Mood stabilizers, Depakote. So Depakote is a mood stabilizer. It's also called valproic acid. It can also be used to treat seizures. Depakote's a great drug. It's very well tolerated by most people, but Depakote actually is very well known to cause birth defects. It interferes with the processing of folic acid. So as a result, people can't process folic acid. So if you're a woman and you get pregnant, you're very likely to have a baby who has a neural tube defect. That's a defect with the brain or the spine. But if you don't know that and you're taking it and you accidentally get pregnant, that's where the issue lies. And so a lot of people aren't told those things, and they need to be told those things ahead of time. And so that's why when you guys are of childbearing age, you want to make sure you know what's being put into your body. So I hope that answers that question. So like, seriously, guys, I have no more questions. So if you guys are on there, you need to go ahead and pop any questions that you have into the chat. We are going to be coming out with a couple different new videos soon. So keep a lookout for that. And we'll keep you updated. The holidays, I think, have wrecked everybody. Do you have or can you do a video on placenta calcification? What is it? How common is it? When to worry? And what would it cause? And when would it cause an induction to be medically necessary? Tess, love it. No video. Going to tell you a little bit about it. And I am totally going to do a video on it. That's actually a good one. So placenta calcification is basically when the placenta starts to get old, and it's literally what it sounds like, calcification. It actually gets hard spots. And I've seen calcified placentas, but basically parts of the backside of the placenta are like hardened, like little rocks or stuff like that. And it's usually the sign of an old or failing placenta. Now, it's not common. It is becoming more common. And I think it is due primarily to hypertension. High blood pressure in pregnancy, guys, is a very big deal. And so high blood pressure is this tricky thing because when your blood pressure is high, if we don't catch it soon enough and the blood pressure is staying high most of the time, we can't lower your blood pressure too low, even into like a normal range, because then the placenta won't function. But then at the same time, the placenta is being exposed to higher pressures, which puts a lot of pressure on these little blood vessels, which can eventually lead to some of these calcifications. When do they worry? Okay, so there's a couple reasons why they would worry. Usually it comes down to circulation, blood flow, and baby size. So blood flow. If we have a failure to thrive, usually the baby's not developing the way we want the baby to size-wise because they're not getting the right blood flow. Those moms are usually sent into the hospital and placed on in-hospital bed rest while we monitor them. That's what like one of my areas was I worked in high-risk antepartum. Antepartum is like the medical units for pregnant women who are sick. And one of the things that we would do is we would do daily Dopplers and daily Doppler flow. And Doppler flow is basically looking at the arteries in the vein in the umbilical cord placenta and seeing how well that blood flow works. Eventually, a failing placenta, often due to calcifications, instead of the blood flow going back and forth, it only reverses. And what I mean by reverses is it's only leaving the baby. It's not coming in. So imagine what I'm saying right now. The blood flow is only out. It's not in. Once the blood flow is only out of the baby, it's a medical emergency and we're delivering the baby right away, usually by C-section. So usually leading up to it nowadays, if somebody's getting good prenatal care, we're going to go ahead and we're going to be monitoring them very carefully for that. And when would an induction? When you have reversal of flow, for sure. Usually those end up as a C-section anyway, because we've been sitting on that baby for so long, the baby can't tolerate labor. It can also happen if the baby is not growing well. Those are usually the two things, but it's almost always nowadays a sign of a distressed baby or we've been buying ourselves time. The blood flow's been the placenta has been the growth has been and we got to 39 weeks, we're going for it. A lot of people don't realize that a lot of 39-week inductions are done because the mom that's presenting has a history of previous complications. And we just don't want to let her go any longer than we absolutely have to. So, but placenta calcification is a very, very big deal because every area of the placenta that is calcified, there's no blood flow coming through it. So I hope that helped, Tess. Any other questions? That's a really good one. Can you, I'm talking to my producer. Can you screenshot that for me? Is there a rate of severity? I'm sure there is, Tess, on the rate of severity, like how bad the calcification is, but I don't know it off the top of my head. That I totally have to look up, but I'm sure there is. Because there's like the reversal of flow, when you have that blood flow going back and forth, that's definitely rated. I'm sure there's got to be like a percentage. So it's one of those things that's there somewhere, but I've never seen it. I don't think I've ever seen it used. It's probably only used on like delivery reports, to be very honest. But I will tell you from personal experience, placentas are no joke. So my son, I had severe hyperemesis gravidarum with both of my children. My son was actually born at 43 weeks. Now, at the time, we didn't know that. So I have a history of cancer, and my history of cancer when I was young made it so that I didn't have regular periods. I didn't quite know exactly when I was going to get a period. And we were also told that it would be hard for us to get pregnant. Now, we got pregnant fairly easily with our daughter, but again, with our son, we had been told previously, and it's taken us a little while. So we get pregnant, and because of my lack of having periods regularly, didn't know exactly what my due date was. I'm old, guys, so my son's like, I don't know, 19, 20. So he was born in 2005. There you go. So he's going to be 20. And so ultrasounds back then, different than they are now. And so we were estimated to have a due date of March 1st. When March 1st came around, we had another ultrasound done, and my son was showing to be only like 5 pounds. And I'd had massive, major hyperemesis the entire pregnancy. I'd lost like 30 pounds. I went into premature labor at 32 weeks from vomiting 10 times in one day. Like, it was a thing. So we all assumed my dates were off. He was born on March 18th. It was an induction when he was born because I didn't go into labor. And when he came out, my son was 7 pounds, 10 ounces, and 23.5 inches long. He, honestly, the cutest kid in the world now, but at the time, he did not look well. My son was very, very sick, and my placenta was not good. I'm sure I had calcifications. I don't know now because I was just a layperson. I was just a mom. I did not know to ask, but I can tell you from what I know now and what I remember of my son, he was very sickly. And I do remember the doctor saying we were very lucky that we hadn't lost him because he was way overdue. And that's why a lot of people wonder why we don't let women go longer. Once you're past 42 weeks, your placenta is failing. It's old, it's elderly. It is not meant to function after that. And so if we don't get that baby out, what happens is the baby starts to lose the right amount of healthy blood flow. And what can end up happening is something like my son, who grew in one way, but not the other way. And it led to, like, he had some temperature control issues after birth and stuff like that. So, you know, it can be a real thing. And we're very, very lucky and blessed that nothing happened to him, but it could have. So that's why it's such a big deal. And if they suspect it now, they want to take care of it. But grain of salt, I have seen women have C-sections because they were told their ultrasound said the baby was, 10, 11 pounds, and the baby came out at 7 pounds. So unfortunately, technology is not perfect. Hope that helped, Tess. Anybody else? Any other questions? Going, because I am going to be gone and go back to work. If you guys would please like and subscribe to the channel, share it with your friends and family. Follow us over on Facebook and Instagram. We will be here next Monday at 9 p.m. Eastern Standard Time to answer all of your questions live, as well as any questions that you have put into onto the channel. We are the ones that are looking at it myself. And I am the one who answers, and I'm really, really, really very grateful for all of your support. So I hope all of you have a wonderful, wonderful night. If you guys have any questions or anything, please feel free to put some comments over onto the channel, and we will see you next week. I'm Dr. Samantha, the maternity mentor. Bye for now.